Hello everyone, welcome back to my channel. So today we are going to talk about removal of urinary catheter. As someone commented in the section below that I will just read out the comment. Hi, will the catheter have fluid in it or normally empty? If it has fluid, can't we not just verbalize I will empty it in the toilet before catheter removal or note the volume and color of the urine? So what this person is saying that if there is fluid into in the urine catheter, or do we need to clean the genitalia after removing the catheter? So I will make sure that I clear all of her doubts in this video. This comment is from Kamaljeet Kaur. So we will talk about this today. Let's begin. First of all, I will read you the actual procedure. Maintain hand hygiene and wear non-sterile gloves. Release leg support for easier removal of the catheter, then expose only the necessary parts. Inspect and describe contents of catheter bag and perineal area for signs of infection. Having checked volume of water in balloon, see patient documentation or ask the assessor to confirm how much water is in the balloon. Use syringe to deflate balloon. Ensure balloon is completely deflated before removing the catheter. Ask the patient to breathe in and then out. As patient exhale, gently but firmly with continuous traction, remove the catheter. Check the volume of urine in the bag to relax pelvic floor muscles. Clean area around the genitalia after catheter is removed. Wearing clean gloves, use saline soaked gauze to clean the meatus. Then another saline soaked gauze for one side of labia and another one and another one for the other side. Cover patient afterwards. You can encourage the patient for general cleansing to prevent ascending infections. Encourage patient to exercise and drink 2 to 2.5 liters of fluid per day to prevent UTI. Instruct patient to report whether she has passed urine normally so it can be recorded. Dispose of equipments including apron and gloves in an orange clinical waste bag. All right. So let's just talk about her comment now. What she said was, will the catheter have fluid in it or normally empty? So normally nowadays, due to COVID, there would be no fluid in the catheter bag. It would be empty. After that, she said, if it has fluid, can't we not just verbalize I will empty it into the toilet before catheter removal and note the volume and color of the urine? Of course, you can say that. You can tell the accessor that I will empty the urine into the toilet or into the sluice room, and I'm also going to monitor the volume of the urine and color of the urine. Next question she added, do we have to clean the genitalia after removal of the catheter? Of course, we have to clean the genitalia after the removal of the catheter, but before you remove the catheter, you can just assess the genitalia and say, as I can see, there is no signs of infection, there is no redness, and there is no further need of me to clean your genitalia at this time. So you can start removing the catheter. In the beginning, you don't need to clean it, but at the end, after removal of the catheter, you can do so. All right. I hope it's makes sense. Next question she asked, where is it? Can't we just use up gauze to pat dry and encourage the patient to have a good wash later from front to back? Of course, you can do that, but in the criteria, it says after catheter removal, you can clean the genitalia first. First one is the meatus, then another side of the labia, and another the other side of the labia with saline soaked gauze. So you just don't want to tell. Of course, there is no harm to tell the patient that they can clean it as general guidance, but in your exam you can tell the patient to follow whatever you are telling to them. I mean, you are doing a procedure, you removed a catheter. So you can tell the patient, I will clean your genitalia in the middle one first, then on the other side, then the other side. So you will complete your procedure. I think it would be better just to do it, you know. The next question she says, do we have to change gloves before padding dry the patient and covering them back? Yes, you have to do that, because what happen is when you remove the catheter, you have touched the insertion of the catheter side. Okay, so it's in the marking criteria that you need to change your gloves, wear a new pair of gloves, and then clean the patient. So before cleaning their genitalia, you need to wear a new pair of gloves. Okay, so I will just tell you about the post procedure protocol. Also, you're going to dispose of the equipments, including your gloves, apron, in the orange clinical waste bag. And then you can also tell that you will discard the urine in the sluice room to prevent environmental contamination. Then you can tell the patient that I'm going to document into your notes that I have removed your catheter, and then the volume of urine also you're going to document, so they can compare in the future if they need to, just to make a comparison, you know. Then you can ask the patient about their comfort and safety, patient privacy throughout the procedure. At the end, you need to clean your hands, thank the patient, and finish the procedure. I hope, Kamaljit, this video was helpful for you. If you have any more questions, please don't hesitate to comment in the section below. Share this video with your friends and keep watching the videos. Good luck for your exam. Thank you so much. Take care. Lots of love.